reason number 33 to get a Nissan. The cold. Because winter isn't done with us yet. Good thing the 2026 Nissan Rogue was built to conquer all conditions. With intelligent all-wheel drive, standard heated front seats, heated steering wheel, and heated mirrors, you can leave the worst of winter out in the cold. Lease the 2026 Nissan Rogue S starting at 0.4% for up to 36 months. Includes a 0.5% loyalty rebate for qualifying Nissan customers. Until March 2nd on approved credit. Conditions apply. Details at Nissan.
Starting February 7th of next year, Quebec will tighten its rules on reimbursing prescriptions marked Do Not Substitute. Prescriptions for brand name medications, like those for anxiety or diabetes, will be reimbursed at the lower cost of generic alternatives unless there's a medical justification. This change is expected to save up to $12 million annually. Let's find out a little bit more. Dr. Laura Sang is a family doctor in the Lower Laurentians, and she joins us now. Hi, Dr. Sang.
Good morning.
Good morning. So let me ask you this. Why would a prescription that you give to a patient, why would you mark it do not substitute? Give me the conditions where you would say, oh, this is important, I'm going to do that.
So some people have, allergies to certain medications that, the brand name, works well for them, but the generic does not. That's because medications have both medicinal and non-medicinal ingredients, and the medicinal ingredients are the same throughout, whether it's generic or not. But it's the non-medicinal things that can vary, and sometimes people can have allergies to that. They can have intolerances. They can have, some people have noticed that a generic might be less efficacious than the brand name. So those are all some of the reasons that I tend to, request do not substitute. If I remember correctly, I know the generic that starts with APO is actually, gluten-free. So people who have celiac disease might not be able to take certain medications if there's traces of gluten in the non-medicinal ingredients. That's also something to consider.
Now, this change, of course, affects people who are on the public program, right? This is not if you've got private health care at work. This is for people who are on the public program, correct?
Yes, but I've also seen this with various insurance companies that they're not covering the brand names and that they're starting to only cover the generics as well.
Okay, gotcha. I think I've seen a case like that before as well. Okay, so how would you, what do you think the ramifications are here? What do you think are the consequences of this decision? Are they high or is it negligible here?
I think that, for the vast majority of people, the generic should do the same job. But as long as, if the generic isn't working and we're able to try the brand name, and if we see that there's a better success rate for whatever reason, that we're still allowed to prescribe it, that the do not substitute is still something that we can request. I think that's just the main thing. But I have no issue with trying generic medications on someone, especially if it makes it more affordable to the person. I have so many patients that struggle to pay for their medications. So if there are more generics available that make it more affordable, I think that is a positive. What
about the requirement for medical justification? If they're going to get the non-generic version of the drug, are the requirements onerous? Because I hear Quebec is tightening the rules. Will it still be possible here? Are you worried about how tight tighten means?
I worry about what paperwork might be added to doctors trying to prescribe this. Usually when we're trying to, prescribe a medication, for example, that, you need to meet certain criteria, either there's a code that we can add to that medication that we write in the prescription, or we have to fill out a form for like médicament d'exception, explaining why we need this medication covered. So if there's a code or, if when we write do not substitute, whatever justification we have to provide isn't too time consuming, I think that would be fine. But if they, add too many hurdles, it might take longer for someone to get their medications. They might end up paying out of pocket. And, that's a big cost to someone who's already struggling to afford, the basic costs of living. And I worry that it might affect, patient adherence if it's hard to get the medication that they need, that they won't be taking it as regularly, and that could, lead to an imbalance in certain conditions.
Now, you mentioned before the non-medicinal ingredients, and sometimes there's allergies. Is there any other types of cases where a patient should be insisting on the brand name medication over the generic?
I mean, I don't know of, apart from like serious reactions or allergies, I can't think of anything, but I know that it's sort of on a case-by-case basis. And I've had a few patients in the past tell me that they've tried generic versions and it didn't work the same for them, or they had more side effects, or it didn't react the same way with their body. So I think that, if someone is telling you this, I tend to take it seriously and ask not to substitute. I try to do no harm. And if I know that there's something that works, I know a lot of people also are afraid to change. If they've been on the same brand name medication for 20, 30 years and suddenly they have to change to a generic, I know they're worried about that. I also know some people who don't know their medications as well, and they see a different color or a different shaped pill and they worry that they're getting the wrong medication. So that's happened a few times where it's been switched to a generic and the person wasn't informed and they thought that they got the wrong medication, so they didn't take it. So, I think there needs to be some transparency in this process.
We're with Dr. Laura Sang, family doctor in the Lower Laurentians. Just one thing here on the money that's going to be saved. $12 million. I was actually surprised at how low that number is. Is it possible that the juice isn't worth the squeeze?
I mean, it's possible. I think we need, some studies, cost-benefit analysis, to determine if that's the best place to cut. I think, it's better than cutting services, but how much of a dent is it actually going to make? I'm not sure.
And are you seeing other examples of budget cuts? Clearly, this is the government trying to save money here. In your day-to-day as a family doctor, where else are you seeing budget cuts come down from high above?
Well, sometimes I've noticed less postings available for nursing staff and allied healthcare support at some of the workplaces in my area. I've noticed, I don't know if it's so much of a budget cut, but I've noticed more and more that there's different medications that are on back order or that we have to substitute because they're running out of things. I've seen shelves more empty than I remember them being. And I don't know how much of that is economic, political situation versus, true budget cuts. Yeah. I've seen cuts to administrative staff, which makes things tricky because we rely so heavily on our administrative staff to coordinate, getting different tests done and that sort of thing. So that's a big one. And I think in general, just sort of limiting the scope of practice in terms of like supplies and trying to, limit the variety of things that we have in the office and try to streamline it a bit more. Those are some of the things I've seen on the day-to-day, but I feel like a lot of the changes that are going on haven't reached my level on the front line yet.
Dr. Laura Sang, we have to leave it there. It's always a pleasure catching up. Thank you so much for getting your insight.
Thank you.
That's Dr. Laura Sang, a family doctor in the Lower Laurentians.